Bottom line, it's real simple. Arthritis doesn't cure itself. It's got to be cured. I could live with the pain and the discomfort, the lack of mobility, or get it fixed.
He initially recommended a physician in Austin. I went to see him, and his schedule was very full, although he was going to be able to work me in eventually. But then he said, you know, there's a person with just this specialty that's just moved to San Marcos. And at that time, several other people that I know in the medical community here were telling me that Dr. Jimenez was coming and that he was, you know, very well regarded in this specialty. So that's why I decided to try.
I made an appointment and I met him. I was impressed. Easy to talk to, told you everything step by step by step by step, what I needed to do, and I was just real impressed with him.
Well, it was terrific. I mean, the clinic is very friendly, certainly the staff is great, and certainly Dr. Jimenez is very open, very friendly, very ready to answer all your questions, and very personable.
He was very straightforward, told me exactly what I had going on, exactly what my options were. He basically told me that when I was ready and made a decision on my own, that I would come see him to have a procedure done. I'd actually had looked at another doctor prior. I probably could have gone there, but after talking to Dr. Jimenez, he just made me feel more relaxed. Felt like he probably cared more about what was going on with me rather than some of the other docs and the other places were like cattle running through a chute, so to speak.
Yeah, I was here at CTMC and it was terrific. I couldn't say better things. Everything went very smoothly at the hospital. And certainly as far as this surgery goes, I've not had a lot of surgery in my life, but it went great. I mean, the recovery is very fast. You can't say it's pain-free, but it's a minimal of pain. After the second day, maybe, and when I left the hospital, I was given prescriptions for pain medications, but I really didn't use it, not because I was being stoic, it just didn't hurt that much.
The next morning, I walked 2.1 miles on the 3rd floor at the hospital without a walker. I made a couple laps carrying the walker, and I finally asked the nurse, do I have to carry this thing anymore?
He's very personable, he's also very professional, he's very well trained and knowledgeable about what he does and the procedure he uses, and very particular about how procedures are implemented and how follow-up comes through. And he will go to great lengths to be sure it goes to those according to his directions. And he's also very accessible. He'll even give you his cell phone, and he's very nice, as is his staff, about you contacting them with any questions.
They're just so kind and caring, thoughtful. Anytime I call the office and I need a question answered, they immediately will go find him and ask him, and then they come back and give me the answer, or if he needs to talk to me, he'll get on the phone. It's great. I have a lot of confidence in the staff and Dr. Jimenez. I don't dread getting up and walking anymore. And I'm very active. I live on a little small farm, and I have a lot of animals to take care of, and I haul hay and haul feed, and that had gotten to where I was having to call on somebody to help me. And then now I can do it again.
The little stuff you take for granted, and then you don't realize how much you were missing until after you have that surgery, and then you're back to normal again. You go, oh wow. I've been asked several times, did you have any regrets? My only regret was I didn't do it sooner.